Hi all, hope you are doing great. Today we are going to see about the topic antenatal care or ANC. Antenatal care or ANC, we'll go through its introduction, what are the objectives in ANC, the importance of antenatal care, principles, and what is the schedule of visits, and also the clinical part. Under that we'll discuss about history taking, examination, investigations, what should be done in the antenatal care, and the management as well in the OPD and IPD basis. So let's begin with the topic today. Antenatal care means the systematic medical supervision of a pregnant woman during pregnancy, right from the time of conception up to the onset of labor. So that is the antenatal care. So the main goal is very simple in antenatal care. It's to make sure that both the mother and the as well as the baby remains healthy. And it's not just about treatment, it's all about prevention, early detection, and management and timely management of complications if happens during the antenatal time. And so in short we can say ANC or antenatal care is like the foundation of safe motherhood, because during the antenatal care checkups only it's very important. It's very important because during this antenatal care visit time we'll be able to monitor both the mother's health as well as the fetal health, and we can guide the patient accordingly and manage the condition if anything occurs during the antenatal time. So this is the basic introduction of what is antenatal care. Moving on to the objectives of an ANC, antenatal care. So the objectives are like quite straightforward. Number one, to promote and maintain the health of the mother throughout the pregnancy. Second, to detect any high risk cases early, like hypertension, diabetes, anemia, so that we can guide the patient and manage the condition before any complications comes in. Third is to ensure safe delivery of the healthy baby. Fourth, to prepare the mother for the lactation. So breastfeeding can start immediately after birth. So during this time we'll prepare the mother. What we'll guide the mother, and we'll to educate the patient regarding the breastfeeding and lactation time, so that because the after as soon as the after delivery the breastfeeding is start, so we have to the patient should know what should be done and how to do all such things. And lastly, to educate the mother about the nutrition, hygiene, and newborn care. So you can see ANC or antenatal care is not only about the survival of the patient but also about improving the quality of life during the motherhood. So these are the five major objectives of antenatal care you should be aware of. Next is the importance of ANC. What are the why ANC is important? Why antenatal care checkup is antenatal care is important? Because it is one of the most powerful interventions to reduce the maternal and neonatal morbidity and mortality. If a mother develops complications like preeclampsia or gestational diabetes or ANC, gestational diabetes during the antenatal care, we can ensure the timely detection and treatment of the condition. So it also improves the maternal nutrition and mental health. Since the mother receives the counseling and guidance, we can improve the quality of life of the mother of the patient of the mother during the motherhood. And very importantly, this antenatal care promotes the institutional delivery and skilled birth attendance, which will drastically reduce the unsafe home births and later deaths. So usually there will be people who are more like they wanted to do a home birth and such things. So during the antenatal care we can guide the patient, and with the it will be very important to promote about the institution delivery and educate the patient about the skilled birth attendance. So it will be very easy for us to reduce any unsafe home birth and related deaths. So these are the four importance of antenatal care checkups or antenatal care visits. Principles of ANC, or what are the things, guiding principles you should be knowing about the antenatal care. The guiding principles are: first is early registration and regular follow up. So, early registration of pregnancy is ideally within the first trimester, and regular follow up also should be done during the first early pregnancies. And second is the regular follow-ups, as I've mentioned, regular follow-ups throughout the pregnancy. Next is a holistic approach: physical, mental, social well-being of the patient. So we have to take the note of physical health, of mental health, and emotional health and social well-being mm, of the mother. We have to take a holistic approach towards that. Next is preventive, promotive, and curative care. So antenatal care should be able to provide the preventive care to the patient, promotive care to the patient, and curative care to the patient. And lastly, patient education and counseling. So educating and counseling of the mother, along with the family involvement, is very important during the pregnancy journey and motherhood journey. uh, because this during this time or this phase of motherhood, during the antenatal checkup, when we guide the patient, they'll be more aware about the consequences or any complications they get, or higher risk of the conditions, or what all things they have to follow during their daily routine, and all the things which we guide them to do in the antenatal care. You will be able to educate the patient regarding, and we all can also give a counseling, moral and mental support to the patient during their pregnancy journey. So these are the principles of antenatal care checkup. Moving on to the schedule of ANC visit. So now, how many visits should a pregnant woman ideally have? Normally, when a patient gets pregnant or the mother get pregnant, if a woman get pregnant, they will be having a constant thought or questions regarding how many visits they should do to have to do with the gynac or OBGYN, to have a antenatal care. So, first visit should happen as early as possible, preferably like within 12 weeks. And at minimum, 4 visits are recommended. The first, as I mentioned, up to within the up to 12 weeks, or within 12 weeks, they should do their first antenatal checkup. Second is between 14 to 26 weeks. Third is between 28 to 34 weeks. And last, for the fourth visit can be at 36 weeks or later. So this is the minimum 4 visits which is recommended to the patient or the mother or the woman to do the antenatal care visits. So of course, high risk pregnancies require more frequent visits, but at least a 4 visits minimum should is recommended. WHO now recommended, like recent studies have recommended 8 visits for even better outcomes. So minimum 4, maximum you can go for up to 8 visits during the antenatal checkup, antenatal care. So that is very important. So in cases, if there are any cases of high risk pregnancies, it is better to advise them to come for regular checkups more frequently, more than maybe required, maybe more than 8 weeks or 8 visits. So that is very important in case of antenatal care. So this is the normal schedule of antenatal visits a patient, a woman or mother should be doing during their pregnancy journey. Next is the history taking in ANC. So, history taking in ANC, what all things you should be considering about the patient during the what you can call antenatal care checkup. First, like when a pregnant woman comes for the antenatal checkup, The very first step is very important, that is detailed history taking. So first one, we'll ask for personal details like age, occupation, if the patient is working or not, socio-economic status, and their background, etc. We'll be asking their personal details. Next second thing you have to ask is the obstetric history. That is gravida, para, or any abortions, live births, or live children. So these things you should be asking to the patient while taking the history. Third is you should ask about their menstrual history, last menstrual period, LMP, and cycle regularity, if the patient had a regular cycle, or so regarding their cycles, and expected date of delivery. So everything this should be taken during their menstrual history. Fourth is medical history. So, all it's very important to ask the patient about their medical or previous surgical history and all. So, medical history, under that, you should be always asking the patient regarding if there is any hypertension or diabetes, diagnosed diabetes or thyroid disorder or TB, tuberculosis, or if the patient is under any medications for thyroid or any hypertension or sometimes diabetes also. So all these things comes under the medical history, so it is very important to ask about their history. Next is family history. So especially like why we are asking family history, because especially of their genetic disorders or any twin pregnancies. So for that, family history is very important, regarding like while taking the history of the patient. Next is past surgical history. So if the patient had gone through under any surgery, it can be C-section, cesarean section for first pregnancy, or gynecological surgeries or anything. Regarding that, you have to ask, not only gynec related, or pelvic surgeries. You can also ask about any other surgeries they have gone through before in their life. So that are the past surgical history you should ask about the patient during the antenatal checkup. So these are the very important points you should be knowing when the patient comes to you during their checkup, or their first during their first visit to you, in their first antenatal visit or care. So this all these points, or the while during the history taking itself, we will be knowing what their conditions are, and this will help us to identify whether the mother is at low risk or high risk condition. So that is the importance of taking the history in ANC. Moving on to the examination in checkups, antenatal care, antenatal checkup. Next comes the first is general examination. So on general examination, we should check the height, weight, BP, pulse, like blood pressure, pallor, edema, and all. That is a general examination you should do the patient. On systemic examination, you should focus on the heart, lungs, and thyroid and all. Then comes the obstetric examination. So under the obstetric examination, we will measure their fundal height, check the lie presentation of the fetus, and auscultate for the fetal heart sound. So that is the obstetric examination we'll do to the patient. And in case if you needed for any if needed, you can go for a pelvic examination also. It is done to assess the cervix and pelvis adequacy. So cervix pelvis adequacy, when indicated, only if it is indicated you can go for a pelvic examination. That is very important. So you can do initially you can do the history taking. The next part is examination, general examination of the patient, and next is third, systemic examination of the patient, and obstetric examination of the patient. So in case if needed, then you can go for a pelvic examination. So that is the examinations you should do when the patient comes from the first for an antenatal care checkup. Next, move on to the investigations in antenatal care or checkup. So investigations, what are the investigation we can do in the antenatal care? First is routine test. So a routine test, it include hemoglobin, blood group and RS typing, urine of albumin sugar, urine routine, and screening should be done for HIV, HBsAg, and syphilis. So these are the routine checkup, routine test you should be advising to the patient. Next is ultrasound. So ultrasound is extremely important because the early dating scan, the anomaly scan around the 18 to 22 weeks, and later growth scans, so growth monitoring. So these all thing can be done in the like while doing ultrasound. You will be knowing the things, and it will help us to guide the management. Next is the special test. So there are few special tests should be done in the pregnancy, like OGTT for gestational diabetes. So in case if the patient is diagnosed diabetes, gestational diabetes, you can go for an OGTT test. Thyroid profile if thyroid is diagnosed, and torch panel, TURCH, if it is only done when it is indicated, clinically indicated. So this special, it is not always necessary to do all this special test. Only if the patient is diagnosed with the thyroid, diabetes, and all, you can go for this special test like OGTT, thyroid profile, and torch, only if it is clinically indicated. So and there are few other tests also. Only other tests you can do based on the your clinical suspicion. So these are the investigation which help us to detect any complications, like early complications, or and so that we can manage the condition and manage them effectively. So this is the investigations we should be doing in the antenatal care. Moving on to the management. So how you can manage the patient in OPD basis and as well as in the IPD basis in antenatal care. In OPD management, most of the antenatal care is provided on an OPD basis only. So what we do here is regular follow-up visits with the monitoring of weight, blood pressure, and fetal growth, and we'll guide them to take iron and folic acid supplementation throughout the pregnancy. Calcium and vitamin D supplementation is given. Next is deworming after the second trimester. Next is a tetanus toxoid or TD vaccination. The TT or TD vaccination is very important for all the pregnancies. That is one of the important point you should be knowing. Next is detailed dietary advices, and detailed dietary advice also the counseling. So you have to advise the patient regarding their diet. So advise a balanced diet, and which is rich in protein, fiber, and all. So and also we have to avoid ask them to avoid the alcohol, smoking, and drugs if there is any history of the patient taking such or have the habits of these things. So you should always advise them to avoid this. And next, the important point is counseling. Counsel the patient regarding their pregnancy journey, what will happen, what can they expect during the first trimester, second trimester, and third trimester. Counsel the patient, counsel regarding their bodily changes and what is happening in their body. So better counseling is very important to support, to give a moral support to the patient both physically and mentally. So the most normal pregnancies can be successfully managed in the OPD cases only. So this is the most of the time, this is how you have to do the management of patient or the mother in the antenatal care during the OPD visits and OPD management. Moving on to the IPD management in ANC. So IPD management, what and all you should be knowing. Like only when complications arise, we advise the patient to get admitted and get the treatment. So indications for IPD include any hypertension disorder, gestational diabetes, placenta previa, preeclampsia, or any kind of bleeding. So in such conditions, we will indicate the patient to get admitted and get treatment. In hospital, the mother and the fetus are closely monitored. So we may also like advise to provide supportive care like antihypertensives, insulin, bed rest, and all. So that can also be given during the IPD management. And Timely interventions like induction of labor or cesarean section if are carried only if it is required and it is necessary. So the induction of labor, c-section is required only during the like condition whether it is necessary and if needed you can do. And in emergencies such as eclampsia or antepartum hemorrhage and all such emergency conditions, you can advise immediate resuscitation and delivery. So it may be like life saving. So in such eclampsia hemorrhage condition, immediate resuscitation plus delivery may be a life saving method. So this is how we have to manage the patient in IPD levels during their antenatal care and antenatal checkup visits. So these are the OPD management and as well as the IPD management of the patient. So to summarize our topic today, antenatal care ANC is what you can call is like a cornerstone of maternal and child health care, both the mother and child. So it's not really we are checking the mother's health or providing support to their mother, we are also supporting the mother as well as child. So you have to know, take care of both mother and child health. Next, what are the objectives we discussed? The objectives are to ensure the maternal well-being, safe delivery and a healthy baby. So these are the three important major objectives of our antenatal care. And next is the importance. What is the importance of ANC antenatal care? It will reduce the morbidity, mortality and ensures the better outcomes. So that is the importance of having an antenatal care checkup. Next is proper antenatal care involves regular visits, systematic history, history taking through examination and appropriate investigation. So that is our main point during the antenatal checkup, or we should advise the patient have a regular visit and take their history properly and examine the patient and advise necessary investigations if required. Next, with correct OPD and IPD management, we can do the we can achieve the goal of a safe motherhood. So we have to know about the proper management of the patient or the mother do of in the OPD basis as well as the IPD basis. So this is the uh, important points which we discussed today. So I have summarized today's topic. Hope you got clear with the topic. So this comes to the end of our lecture today. Thank you so much.